I'll be very
Thank you,
happy to
Dr.
take any
Rai,
questions.
for an excellent and lucid presentation about the evaluation of the prosthetic heart valves. Is there any question from the audience?
I have a comment. I'm Chourangshu.
Yes, sir.
You have mentioned that the pressure half time is the way to calculate the mitral valve area, prosthetic mitral valve area.
Sir, it is one of the parameters, sir, not the very
But
most
that is
important
fallacious,
parameter.
you know,
Yes.
because
It's
of
fallacious. Yes.
not
has to be
unlike
used
in normal
only when
mitral valve, we have to
Yes,
use the
absolutely, sir.
continuity equation
Yes, absolutely, sir. We have to
because of the altered compliance in LA and LV. The pressure half time can be fallacious.
Absolutely, sir. It is only
That's
one
right.
of the parameters that we have to
That's right.
calculate along
It
with
only gives you an idea whether the pressure half time
yes.
is less than 130 or more than 130, and you
Yes,
can go
absolutely.
along the flow chart.
Only if it is more than 200, we can say less than 200. It is early indicator of a valve obstruction. But at the same time, we have to measure the peak velocity, the peak gradient, mean gradient, which are more important. Mean gradient, which is more important.
Dr. Kajal Ganguly is also on the chair. Kajal, you have something to say, please.
Thank you, Shilanjan, for a beautiful deliberation. One thing I want to comment that when you show up the dehiscence and the abscess, they sometimes look alike.
Yes.
And the flow only differentiates whether it is an abscess or an dehiscence, right?
Yes, sir. And also the movement of the excessive movement of the valve root, that is an indicator of dehiscence. Whereas in abscess, the valve root will be more or less static, and there will be a severe paravalvular regurgitation. So that dehiscent valve, that excessive motion of the valve root, that is an important indicator in 2D image.
Right.
Not only the excessive movement, it is the to and fro motion. This is the bizarre movement. That is the most important.
To and fro movement. Yes. The to and fro movement of the valve root. Yes.
In the dehiscence.
So another case you show about the Bentel's operation, na?
Yes, where the entire prosthetic root as well as the aortic valve got, it got separated from the native aortic root, and it was seen freely hanging from within the aortic, dilated aortic root. So it's a failed Bentel's procedure.
There is no other choice.
Yes.
Right. Good. This is a good deliberation. Very good.
So
the important point that I wanted to emphasize was that that is the early identification of valve thrombosis to intervene early. Next is to differentiate between pannus and thrombus. That is important. Early identification of any abscess, root abscess, dehiscence, all these things I have tried to incorporate into the
right. And valvular mismatch also.
Yes, patient prosthetic mismatch.
Yes, that is very important.
Mismatch, yes.
Because thrombosis, antithrombotic is life-saving in those cases, na? So you have to see it early. Good.
It appears there is no further question, no further comment. I would like Dr. Anirudh to conclude the session.
So overall, it's a very excellent presentation of Dr. K. Raghu, Dr. Aruna Seal, and Dr. Shilanjan Rai, and we have all enjoyed all the topics. And thank you everybody for the participation and all the chairpersons and the panelists.
Thank you.
That's why I close the session.
Thank you very much, sir.
Thank you.
Thank you, chairpersons and speakers, for an excellent session. Now we move on to another interesting session. A session of the symposium. I would request the chairpersons, Dr. Shankar Mitra, Dr. Shankar Mondal, Dr. Achyut Sarkar, and Dr. Soumitra Kumar to proceed.
Yeah, thank you for the kind introduction. Professor Achyut Sarkar, are you with us?
Yeah, I am very much with you.
Yeah, you are not visible. Please put on your video. So since I have the list of speakers with me, I will seek your permission to introduce the speakers, and I will request you to please initiate the discussion once I have called upon the. So we have 4 presenters for this much evening, the case presentations, and in any of the previous ECHO conferences, this has been a much sought after session. So I will request the first presenter, Dr. Pooja Sinha, who works in the Department of Pediatric Cardiology at NH Arctics Hospital, Kolkata. So, Dr. Pooja, please present your case.